Hello everyone, welcome to Phonics. So our today's topic is fetal monitoring. It is a very important yet ignored topic and I hope your all doubts will get clear after this video. Let's begin with the fetal monitoring. So when we do the fetal monitoring, it is during the antepartum period and it's during the intrapartum period. Intrapartum mean that is during the labor. Okay. So when we start doing the antepartum fetal monitoring, it is during the 32 weeks. It is around 32 weeks. It is the new question. So there are many components through which we can check the fetal monitoring during the antepartum period. The first one is the fetal movements, second is the Doppler, third one is the VAST, and the fourth one is the ultrasound. So we will be studying it one by one in detail. The first one is the fetal movements. So first, what is the normal fetal movements? Normal fetal movements are 10 fetal movements in 2-hour period of the rest. So if our fetal movements decreases, so what we will be doing next? So then we will be doing the modified BPP. It is known as a biophysical profile. So what are the components of the modified BPP? It is the amniotic fluid and the NST. Amniotic fluid will indicate the chronic injury and NST will indicate the acute injury or the hypoxia. So now we will be studying the NST in detail. What is NST? NST is a non-stress test. So there is a machine known as CTG, cardiotocography, and it has two probes. One is the contraction probe and second is the fetal heart rate probe. So we will be using these two probes during if the patient is in labor. If the patient is not in labor, then we'll be using only the fetal heart rate probe. As we have already know that we are doing the antepartum monitoring, so we'll be using only the FHR probe. So this is our CTG graph. So what are the normal components of the CTG? First one is the normal fetal heart rate, that is it is between the 110 to 160 beats per minute. Second one is the beat to beat variability, that is the difference between the two beats should be 5 to 25 beats per minute. Third one is the acceleration. It is more than there is increase in the heart rate by 15 beats per minute in 15 seconds and deceleration is decrease in the heart rate by 15 beats per minute in 15 seconds. Okay. So what is the normal NST or the reactive NST? It is known as a 2 acceleration in the 20 minutes. If we are not getting 2 accelerations in 20 minutes, so it is abnormal. So then what we will be doing? We will be doing we will be repeating it for the next 20 minutes. So if there is less than 2 accelerations in 40 minutes, then it is known as a non-reactive NST or the positive test. What is normal NST or the reactive test is known as the negative test, and but positive test is non-reactive NST and the negative test is the normal NST. So if the NST is non-reactive, what would be the next further step what we'll be doing? So the next one is the biophysical profile or the Manning score. It is done by the ultrasound for the 30 minutes. So what are the components of the biophysical profile or the Manning score? These are the Batman. The mnemonic is Batman. And so what is Batman? Batman is B से है हमारा fetal breathing movements. And it is the one fetal breathing movements for the 30 seconds. Second one is the amniotic fluid. It is one pocket of the 2 centimeters. T से है हमारा fetal tone, that is flexion, extension, flexion. And the M से है हमारा gross body movements, that is there are 3 movements. And N से हमारा NST. NST should be reactive. So the score is +2 or 0. So the total is 10. So what is the interpretation of this? If the score is 8 on 10 or 10 on 10, so it is no hypoxia. If it is 6 or there is a normal amniotic fluid, so it is equivocal. If the score is less than 4 or less than 2, so it is hypoxia. If it is less than 2, then it is 100% hypoxia. So what is the immediate action? We will be doing the C-section of the patient. So BPP is related to the fetal pH and the fetal outcome. So if the score is less than 10 or the pH is less than 7.2 or the score is 0, then it indicates the fetal acidemia. So this sums up our NST. So in NST, what we were doing? We are doing the NST. If the NST is non-reactive, so the next step would be the biophysical profile. Okay. So we are done with the NST. Now the second thing is the Doppler. So the most common artery is the umbilical artery. Okay, so we will be check the uteroplacental insufficiency in the Doppler. Now the third one is the VAST, vibroacoustic stimulation test. In vibroacoustic stimulation test, it is a very interesting topic. In this, we are using the artificial larynx. And what we are doing with it, we are putting the artificial larynx on the mother's belly, and it is producing the high frequency sounds, due to which its reaction, the fetal heart rate increases, and if the heart rate is increasing, then the baby is normal. And the fourth one is by checking the ultrasound. By doing the ultrasound, we will be like assured like the baby is normal. So these are the components of the antepartum fetal monitoring. So next we will be doing the intrapartum fetal monitoring. So in the intrapartum fetal monitoring, the first one is the intermittent auscultation of the fetal heart rate, which is the most commonly used method. In this, we are first seeing the first stage of labor, and there is a second stage of labor, and the pregnancy, if the pregnancy is low risk or the high risk, and we'll be checking it immediately after the contraction, around in 1 minute. So in low risk pregnancy, in first stage, we'll be checking the heart rate in around 30 minutes, and during the second stage around 15 minutes. If the pregnancy is high risk, then we will be checking the heart rate during the first stage in every 15 minutes, and during the second stage in every 5 minutes. So I hope you are clear with the intermittent auscultation of the fetal heart rate. So the next is continuous CTG monitoring. It is a very, very important topic. So if the uterus is contracting and our fetal heart rate is normal, so this is a normal condition. If the fetal is contracting and the fetal heart rate is decreasing, then there is something which is not normal, or there is something there's some pathology behind it. Okay, so we will be studying it one by one. The first one is the early deceleration. So what we are seeing in the early deceleration, first one, it is due to the head compression. Now what we are seeing in the early deceleration, now the thing is, if the uterus is contracting and the fetal heart rate is decreasing, now the contraction peak and the nadir of the fetal heart rate is coinciding, and the beat to beat variability in this condition is normal. As you can see that after every beat it is changing. So in this condition, what we will be doing, we will be changing the position of the patient. Now the second one is the late deceleration. So in late deceleration, there is no the contraction peaks or the fetal heart rate peak or the nadir is not coinciding, and there is a decrease in the beat to beat variability. As you can see that it is a smooth and gradual graph, and it is seen in the uteroplacental insufficiency. And what will be the next step we'll be doing, we'll be terminating the pregnancy. There is a statement question which has come, like there is less than 10 to 20 beats per minute below the baseline, and the graph is smooth and gradual, as we have already seen. Now the third one is the variable deceleration. As you can see in the variable deceleration, there is no pattern between the uterus contraction and the fetal heart rate dip. So कभी भी heart rate decrease हो रहा है and contraction आ रहा है, कोई भी इसका एक दूसरे से कोई relation नहीं है. So initially तो इसमें beat to beat variability जो होती है हमारी normal होती है, but if it decreases और हमारी जो beat to beat variability वो absent हो गई, so then it is known as कि variable deceleration हमारा pathological हो गया है. Okay, so it is due to the cord compression. So there are types variable deceleration. There are types of variable deceleration. There is a classification of it. First one is the mild, moderate, and the severe. In severe variable deceleration, it is less than 70 beats per minute for 60 seconds. This is a PYQ asked in AIMS. If you want to remember mild and the moderate, mild one is more than 80 beats per minute for any duration. Moderate is more than 70 beats per minute for 30 to 60 seconds. I hope this is clear. And the last one is the sinusoidal waveform, which is the worst one. And it indicates the severe anemia or the severe hypoxia, as you can see. So these are our 4 CTG monitorings. The first one is the early deceleration. It is due to the head compression. Second one is the late deceleration. It is due to uteroplacental insufficiency. And the third one is the variable deceleration. It is due to the cord compression. And the fourth one is the sinusoidal waveform. It is due to the severe anemia or the severe hypoxia. And it is from best to worst prognosis. Okay, so this is ELVS. This is the best to worst prognosis. Now the last topic is what is category 3 FHR. It has the worst prognosis, and we'll be doing the emergency C-section in this condition. So this is the sinusoidal heart rate. or if there is an absent beat to beat variability with any of the following feature, like it has bradycardia or recurrent late deceleration or the recurrent variable deceleration. So this is known as the category 3 FHR, and the treatment is the emergency C-section. And I hope your doubt is clear. So I think I'll be summarizing it. Like in antepartum fetal monitoring, what we are doing, we are checking the fetal movements, and for fetal movements we are doing the NST. If the NST is non-reactive, we will be doing the biophysical profile. Okay, it is done. Now in the intrapartum fetal monitoring, what we are doing, we are doing the intermittent auscultation of the fetal heart rate, which is most commonly used, and the second one is the continuous CTG monitoring. And in continuous CTG monitoring, we have early deceleration, late deceleration, variable deceleration, or the sinusoidal waveform. And the last topic is our category 3 FHR. Okay, so it is completed. Thank you.